Well, good afternoon, Facebook family. Welcome. Welcome back for another week at Hope, Health, and Fatherhood, where we're exploring healthy habits that we're working with fathers and how fathers and their role of fathering contributes to generational health building. Today, we've got an exciting interview with someone that I admire who's doing great work, fatherhood work in Fairfax County. Um, but as you know, that we've been exploring for the last few weeks what fatherhood looks like through the lens, through a cultural lens, understanding that fatherhood really is person to person, transcends cultures. And I thought it was, and we think here at the health department that it's really important to look at that. So as I said before, my name is Anthony Mingo. I've got the privilege to serve as the unit manager here at the health department for the community outreach and engagement team here in the health department. So let's get at it because we've got a great interview today. We're going to shift gears a little bit from, although we're going to talk about our guest's personal fatherhood journey, but he's a practitioner. He is been called to this work as one that not only is a dad, but is for many years has been called to help dads. So at this time, I want to introduce to you our guest, Champana Bernard. He is with the Fatherhood Program at Department of Family Services, where he serves as the manager for the program over at DFS. Champana, can you just tell us a little bit more about yourself, and then we'll dig in a bit through some questions. Thank you.
Absolutely. Good afternoon, everyone, and thank you, Anthony, for this opportunity. Fatherhood is my passion, and so I really appreciate the opportunity to speak with you and also our viewers about this. Again, my name is Shimhana Bernard. I am a social worker with the Fairfax County Department of Family Services in the Children, Youth, and Families Division. I've been a social worker for 30 years now, and my career started in New York City and ended up in the Washington, D.C. area by way of Howard University, where incidentally I met my wife. And so in 1999, I became employed with Fairfax County as a frontline foster care social worker initially. In my current role, and I'm fortunate to be in this role, I supervise a father engagement unit, and our practitioners provide a variety of support services to fathers, primarily, some services to mothers as well. Whose children are involved with our child welfare system because the majority of our referrals are coming in from social workers within our child welfare agency, but we also do have fathers who self refer to our group based programming. And so we can talk about that a little bit more detailed later on. And so in my personal life, I play a variety of roles. So I always say that fathers are role models to their sons and relationship models for their daughters. And so, as a father, um, s- there's a phone ringing. Let me get that. Apologies. Um, in my role as a father and a husband, and my most significant influences have been from primarily my father, but I would also say from my wife, and as well as my own journey as a social worker. I think has prepared me for the various roles that I play. From my father, I observed many behaviors that I wanted to replicate as a provider. My father was a an awesome provider. Our family of eight never went without. I grew up originally in Haiti, and so we immigrated to the States um, about 30, 40 years ago now. I'm losing count. But my father was a great provider, and so in that role, in my role as a provider, and also my siblings, four sisters and one brother, um, we really got from our father the value of education and also hard work, and that's reflected in who we are now as individuals and as parents as well. Um, but my father was not perfect in his role, and nor am I, and I don't think there's any such thing as a perfect father. And so there are also various things that I was intentional about wanting to do differently in his other roles as a father. Although as a traditional West Indian man, my father primarily saw himself as a provider and a protector. And initially, I thought, and I said to my wife, "Yeah, I'm going to be a great provider to you and my children, and I'm going to be a great protector in terms of physical protection." And my wife had other ideas, right? And she said, "Well, we'll talk about that when the time comes." So when
Yeah.
my son was born, guess who had was assigned to do the first diaper change? It was me, right? And so I quickly learned that I was going to have to be more than just a provider and a protector. I was going to also be a nurturer and a teacher, which makes perfect sense. And so fast forward, I want to mention, my children, right? And so my son is 22 years old, and so I've been a parent for 22 years, and every single day I learn something new. And I say this to the fathers that we are working with, that it's an ongoing journey, right? And you learn every day something new. My daughter is 17. She probably thinks she's 37 and should have all the privileges that come with that. But she's 17, and I say to her that you are a princess, not a queen, and the queen is your mother. And so at some point, you're going to have your own kingdom to rule over, and you get to be the queen there. But in our household, that's our kingdom, and you're a princess um, within our household. Um, and so I want to go back to the point I made earlier about the fact that fathers are role models to their sons and relationship models to their daughters, because in our work, our role is really to support effective engagement of fathers, so that if their family becomes involved with our child welfare system, that we can support the primary practitioners assigned to those families, support their engagement efforts, so that we can ensure fathers are actively involved in service planning and decision making for their children. And our agency had the foresight some time ago to really decide to have a focus on fathers, because we learned back in 2007, when I joined our quality assurance unit, that our agency needed to do much better in their service delivery to fathers, and especially when they were not a member of the household, and they were non-resident fathers, so to speak. And we needed to do much better. And our data showed that we were doing pretty good job engaging mothers and children, but when it came to fathers, we had a whole lot more to do than that. And so my own journey is very interesting. I ended up in this current position because as a foster care social worker, I became a father in the year 2000. And so and I had already been practicing as a social worker, but I never really looked at my practice through the lens of a father. It was primarily through a lens of a social worker. And becoming
Hmm.
a father really helped me evolve and really improve and enhance my practice, because I started looking at my work with fathers and realized that, you know what, I can also do better. in the ways that I engage fathers and the diligent efforts that I'm making to ensure that they are at the table making decisions for their children and planning for their children, especially if they don't reside in the home with the mother, or there may be conflict in the relationship with the mother. And so, how creative do I need to become in ensuring that the father is part of the team that's working really to address the safety needs, the well-being needs, and permanency needs of children who are part of our system. And so I started doing that, looking at my own practice. And so over time, uh, because I sort of like data, right? And sort of like the macro, I like the micro aspect of social work. And I started wondering how our agency in general was doing in its service delivery to fathers. And so once the opportunity came in 2004 to join our quality assurance unit, I jumped at that opportunity.
Yep.
And so I mentioned that in 2007 we became aware that it was a systemic issue within our agency that we needed to do much better in serving fathers whose children are involved with our agency. And so, with a lot of support from our management, we developed the Fatherhood Initiative. And so, we started out with a two-prong approach, providing training to
Yep.
staff in terms of father engagement, effective strategies and best practices, but also really focusing on building awareness as to the importance of fathers in
Yeah.
the lives of their children, and that when they are actively involved and positively involved in the lives of their children, that we see um, much improved outcomes in a lot of cases. And I always say that it's not a reflection of the fact that a single parent cannot do it, but it's just a matter of when one parent is not actively involved, there's an additional burden on the primary caretaker of those children, and
Yep.
at times the burden is so severe that our agency has to then step in and address safety and well-being of children. And so what we realize is that it's really technically a math problem, right? So when we are trying to support the well-being of children, we want all of the individuals who are significant in the life, of the children that we serve, whether it is the mother, the father, the paternal relatives, the maternal relatives, sort of the village aspect, to be at the table and trying to come up with solutions, strategies, really to address whatever the challenges are. And so, um, what we find is that when everyone is at the table, we come up with better solutions because families are really the experts in their own situations.
Yeah. And Champana, and that is awesome. I'm curious about. You mentioned from a perspective of once you went through the QI process and you've identified some of those areas that could benefit from some greater focus and training. That whole capacity building effort within the agency. You know. It was probably a pretty heavy lift because you have traditional systems and processes and policies that need to be addressed obviously to make that come to fruition. So for those of us that are practitioners, just maybe just briefly, kind of give us a sense of where you were, but where are you now, and all of that capacity building work that I'm sure you had to go through to bring about that awareness and then it literally an impact on policies of your agency.
Absolutely. And so I mentioned that I joined a quality assurance unit in 2004. In 2007, the federal government, as it typically does, conducted a child and family services review, and to assess the extent to which uh, um, child welfare organizations are engaging in best practices and achieving positive outcomes for children. And so that's those reviews are conducted across
That's
the
right.
nation.
Yep.
And so when we looked at the data, we realized that, you know what, we need to do better. And so as part of the quality assurance unit, we started uh, doing ongoing case reviews and looking at the families we're serving, how we're serving them, and how are we effectively engaging all members of the family. And so what we discovered is that we needed to do better. And so in 2007, the Fatherhood Initiative was initiated with support from our management team. And so can you still
Yeah.
see and hear me?
Yeah, I think you were jumping around quite a bit. I didn't want to interrupt, but you
Okay.
might need to, and folks, we're going to ask for 30 seconds grace here to let Champana. There's probably a network interference issue. Let you go ahead and log out and log back in. This is really important information that you're providing, so we want to give
Okay.
you that opportunity to do that. Thank you for your patience, everyone. Okay, glad to see you back.
All right. Thank you. Good.
Look, everybody understands technology, right? It's just on a whim, but we're glad to see you back.
Absolutely.
Um, so for the sake of time, we want to dive in again, just kind of get to a place where the agency is now
Hmm.
with all of that, and maybe from your vantage point, because you really were in the groundbreaking beginning moment of that. Where do you assess your agency is now? And then is there still room for improvement? So just
Right.
really quickly, if we, because there's some other things I want to talk to you about as well.
Absolutely. And so in 2013, we went from starting the Fatherhood Initiative in 2007 with no full-time dedicated positions focused
Hmm.
on fatherhood. I was doing this work part-time, and in my role as a QA consultant, and developing trainings and providing some fatherhood groups. But in 2013, building on the successes of the Fatherhood Initiative, our management decided that they would fund full time dedicated positions. And so from 2013, fast forward to where we are now, we are a unit of four individuals. Two of these individuals are father engagement specialists. And so the support that they provide to fathers, either through individual work with fathers in collaboration with primary practitioners, but also group-based support to our dad's parenting groups, include what we call secondary father engagement support. And so if a primary practitioner is working with a family and the father is protesting involvement with any of our programs, whether it is child protective services or foster care and adoption, or we feel that to our prevention program, there's a need for some support to better engage the father, we step in and we try to engage the father one on one, because at times having a different messenger with the same message
That's right.
sometimes helps. As you know, our agency is predominantly um, staffed with female social workers. And so at times fathers have the perception that the services that are being provided by social services are focused on the mother and the children, and we're trying to change that perception to so that fathers are an active member of the family and should be actively involved as well. So we provide that type of support. We are invited to attend family partnership meetings so that we can be a support to the father, because at time in the room there it may just be the father and the mother and a host of maternal relatives, and the fathers may shy away from really having their voices heard. So we're there to support them and encouraging them to attend the meeting, and also letting their voices heard, so that we can come up with really good solutions in supporting these families. I mentioned the dad's parenting groups. This
Yep.
is group-based support, and so that service is really available to any father in Fairfax County. And at times now that we're offering services virtually, we have fathers who do not reside in Fairfax County, but their children do, and so they are able also to participate in those
So
services.
so before we move forward, let's park on that because I think it's important. Many that may be looking in would want to know, okay, what do I expect? Because you said it's open to any dad, right? Any father across the county.
Mhm.
So what would they expect on day one? One, why should they be encouraged to reach out to you to participate? What are some of the benefits? How are their children going to benefit by their willingness to be involved with this fatherhood program?
Absolutely. We always say that being proactive is the best way to go, right? And so, ideally, and we've had that situation in the past, we would want men to attend the group in anticipation of becoming fathers in the future. And we feel that way because a lot of the fathers and the majority of the men who come are fathers would say, man, I wish I knew about this program 10 years ago or 5 years ago or a year ago. And so our programming is free of charge, and so fathers can self-refer. And so what do they expect? What they should expect is to be a part of an environment where you have a group of men, majority of which are fathers, who come together to talk about their desire to really be the ideal fathers that they want to be,
Thank you.
right? And so, pre-pandemic, we created an environment that was, welcoming, that was there was no judgment in terms of what brings the father to the group. We It's a safe environment where we encourage fathers to participate at their own pace, but also to we encourage them, because what we say is that the more you put into the group, the more you get out of it. And what we will say to fathers as well is that just being a part of the group, you're not just there to receive information about something you can do better, but you're also there to share information about some of the things that you've done effectively that can help someone else who may be in that same situation. And so, the group is really a scenario where it's mutually beneficial, right? The participants not only help their colleagues or other participants who are there, uh, but they get something out of it as well. Initially, early in the program, I used to facilitate these groups as well, and I was a father at that time, and I remember many times listening to other fathers sharing, oh, I had that same situation with my toddler, or I had that same situation with my teenager. And I sort of grew up as a father in Fairfax County in my role. So there was a time I was like, well, I got down to the elementary school age and that stage of development. Now my children are turning 13. So fathers would share their strategies, and I would say to myself, you know what, I need to take notes, because what I've
Yeah.
done so far hasn't necessarily worked. And so even the facilitators, right,
Yeah. Yeah.
who and we don't perceive ourselves as perfect fathers, because we are not, or perfect parents, because we do have a facilitator who is also a female social worker. But we are there to really share information, to have a discussion, and to learn from each other, right? So pretty soon, what you'll find happens in the group is that the participants connect. They develop their own support system within the group, and for the first time ever, they're able to talk about what they felt they never had permission to talk about with
Yeah.
anyone, whether it is their male friends that they're hanging out with. They've had permission to talk about fatherhood, to talk about parenting, to talk about caretaking activities, and in that group they get that permission, which a lot of us felt
Yeah.
that we should have had.
Yeah,
Well,
and I love what you said earlier because it's related to this as well. What you're describing is an environment where it's safe, as you mentioned, but it's a peer-to-peer kind of learning where
absolutely.
even the facilitators are learning as we go. But also, I love what you talked about in your own personal journey, you came to fatherhood with preconceptions. Now, of course, your wife helped to course correct, which oftentimes wives do. To all the wives out there, yeah. Um,
Absolutely. Props to my wife.
but the same sort of thing is prevalent in this environment because fathers would come into a group with those preconceptions, everything from their own, perhaps even their own fatherhood journey. Maybe there's a lack thereof, father absence. Maybe it
Absolutely.
was the environment they grew up in where it was fathers on the street corner that led them, gave them their vision of what fatherhood was to be, was entrenched in absence, in irresponsibility. So obviously I know and you and your team have experienced a lot of this coming in, but what a great thing to be in a safe place where
Absolutely.
over time one could feel comfortable enough to also talk about their past experiences in a safe place, and then allow themselves over time, and I emphasize over time because we know it takes time when you're in these environments to feel comfortable enough to share. But there's an opportunity in a safe way to be able to address those, but also get and gain from new perspectives from other fathers that are in the group. So that's fantastic to hear. The other thing that I heard, my friend, was that, and I agree that fathers that are out here that may be listening, or fathers to be that are out there may be listening. I heard you say that that they could benefit. They could almost look at it as sort of a fatherhood boot camp kind of experience, if you will,
Absolutely.
to learn from fathers. Because truth be told, is you and I both know fatherhood can be quite a concerning or even scary journey at first. So to hear from seasoned fathers, so I would certainly encourage that. Do you want to, just kind of, offer any other
Absolutely.
insight on that?
Absolutely. One of the things I want to mention is that in developing our dad's parenting group, we wanted to offer a service that would really fill a gap in the
Yes.
services that initially we felt existed in our agency. Prior to us bringing our dad's parenting group to our agency, we did have a very strong parent education program that has been serving fathers and mothers and children, for many years prior. To us launching our dad's parenting groups, but those parent education programs involves the entire family, which is very important: the
Yeah.
mother, the father, and the children, and they learn together. And so when we brought our dad's parenting groups to our agency, we wanted to really focus on fathers who perhaps uh, had been alienated from from their family, from their children, have not had the opportunity to have their children grow up in their household, and so the mother and father may have separated, and or perhaps they may not have had their own fathers in their own lives, so their view of family and the roles that they play may not necessarily involve all of the roles I've talked about, beyond just providing,
That's right.
right? Protecting not only physically but the emotional well-being of children and their family, and being an active 24/7 dad, which is the curriculum that we're using, and also helping the fathers really understand whether you are residing with your children or not, you do have an active role to play. And what does that look like in terms of co-parenting? And so, so our target population for our dad's parenting groups are those fathers who may not necessarily know exactly what roles they're going to play and what that's going to actually look like, right? So we engage the fathers and we talk about topics like family history, what it means to be a man, showing and handling feelings, like all of
Yep.
those
Yep.
issues that typically fathers are socialized to see in a certain way, versus, and that may conflict with what they really in their heart want to do, right? And so, well, I want to be involved with my children. However, I grew up without my father, and my mother was there, and she was the one who raised me, and she was the one who was the provider and the protector and the nurturer and the teacher. And now that they become a father, they may be struggling to
Yeah.
understand what their role is in that. And so in the group, we have those conversations. We talk about, the research and how even before your child is born, regardless of whether you're still in a relationship with the mother or not. There are things you can do to prepare to become a father. And when you are a father, there are certain things you can actively do. We talk about, men's health, right? It's sort of concept that first the oxygen mask has to be applied to yourself before you can help anyone else. And so, what does that look like in your current role as a father? We talk about co-parenting. What does that look like? We talk about
But Champagne,
uh,
okay, can I interrupt? So co-parenting is we've got to park here because many of us that are in this work, we understand that father absence transcends generations as well. We're talking about building health generationally, but truth the one of the things that impacts health generationally is the lack of parental presence in the home, particularly when today we're talking about fathers. So co-parenting, whether is really essential to this. For our fathers to understand, those are the fathers who may be listening today that may be challenged in their relationship with the mothers of their children, to recognize how to shift focus away from, sort of, if there's conflict, away from the conflict in the relationship, to really have a child focus.
absolutely.
What's best for the child? If I love my child, I want to be engaged and involved with my child. What can I do to equip myself to be in that child's life? And there is, as you know, there's a real science and a real methodology to, hey, how do I deal with mom in that situation? So I can have perhaps greater access with greater ease. And I want to focus greater on that term, greater ease, because it directly relates to the ability to co-parent with mom. So can you talk a little bit about that and how your program focuses on that?
Absolutely. And I want to say that one of the things that I've had the privilege to experience is that my father was in my life. Right up until he passed 8 years ago, and my parents were remained married until my father passed. But that's not always the case.
That's right.
Specifically with the families that we serve, is significant um, percentage of them, the mother is the primary caretaker and the father is not in the home. At times, we do have scenarios when the father is the primary caretaker, and those numbers are also increasing. And so, we typically will address this issue either because the family is involved with our child welfare system, or at times we get calls from the community with fathers who may be in a situation where they're no longer in a relationship with the mother and they want to be an active father. But because of the conflicts that exist in the
Yep.
relationship, access becomes limited. And so we address those situations on a case by case basis in terms of empowering this father to be an active co parent for their children. But there are times when really seeking court intervention
Yep.
is the way to go. Because
Yep.
there are fathers who are coming in and they're saying, I have not seen my children because of the conflict in the relationship. Um, we're having difficulty of really coming up with a visitation plan, etc. And so, in those scenarios, we would encourage the dads to really go to the courthouse and speak to an intake specialist and really talk about their situation and what's happening, and making decisions whether going the legal route is the right way to go. But there are fathers who don't want to go that way. They want to try to continue to engage the mother. And so, to what you just said is really important for the father to really be child focused and leave the issues and challenges that are the cause of conflict in the relationship with the mother separate to what needs to happen in the best interest of that child. And so we at times, if this is a call for a community, we will give some tips in terms of how to try to engage the mother around setting up a visitation plan. If it's a family that is already involved with us, then we can do some one-on-one engagement with the father to sort of troubleshoot around what, how that could happen in an effective way.
Great.
And so,
Thank you.
but
Oh, sorry. Go ahead. Go ahead, Chaban.
but like I said, at times, cart intervention is needed just to
Yeah.
be able to have to connect, to reconnect that child to his or her father.
Yeah, and I'm sorry to interrupt, but we're kind of close to winding down. So there's two areas I want to put out for us to discuss. One is that I know that the other array of services that you provide in terms of supports for fathers that come into the program, no matter what, the old term is "come as you are," and
Right.
there are perhaps some extra supports that dads might need and directly relate to some of those extra services that you so I want to talk about that,
Absolutely.
and then I also want to talk about at the end so dads can hear this, and the most important message for those dads that want to be engaged, that love their children, is how do their children benefit scientifically, because there's research out there, a body of work for 40 years that
Absolutely.
that can communicate to our fathers that may be listening in on why it's important for them, if they're not engaged, to commit to being re-engaged in their children's lives. So those two things, if we could just take a few minutes to
Absolutely.
talk about those extra services that you provide, and then let's end with
Mhm.
what's most important is the children.
Absolutely. So I can definitely do that. Some of the challenges we typically see that families are dealing with when we are working with fathers involve primarily um, the need to enhance parenting capacity. Right. And so I talked about our dad's parenting groups, which is a way that we address that. We also have our parent education program. If it's an intact family, then it's an appropriate referral for the father and the mother and the children
Yep.
to participate. And those parenting groups are age specific. So if we're talking about very young children and infants, 0 to 4, or 5 to 11, or if you're talking about teens, so we have age specific parent education for our own DAS groups. I mentioned the fact that we typically target the fathers who are non-custodial parents who want to reconnect and have an active uh, participation in their child's life. Other issues that come up in families also involve parental substance use at times, and when you see parental substance use, there could be many causes to that. It could
That's
be
right.
historical trauma with the family. It could be
That's right.
unresolved childhood trauma. We also see in some families the presence of intimate partner violence, where those behaviors, especially if when they occur in front of children, becomes then a concern for us as an agency. And so I'm privileged to have staff who bring their own experience and expertise in each of those areas. Benny Herron from my staff typically addresses and help fathers enhance their parenting capacity through the curriculum that we use, either individually when the fathers are unable to attend the DAS groups, uh, and we have Mercedes Alonso, who bring expertise around how to engage fathers and survivors of domestic violence, because at times it may be the father who is a survivor of domestic violence, at times maybe the perpetrator. And so she bring that expertise because fathers want to be the best fathers that they want to be, and so they also want to address whatever issues or undermining their own children's well-being. And so we are intentional at our agency to engage those fathers early in the life of the case, right? Before a referral to a violence intervention program can be made, we engage them around those behaviors, and Mercedes Alonso bring that expertise to our agency. I mentioned parental substance use. At times, that is the primary concern or one of the concerns that we need to help parents address. Um, and so Michael Scott from my office provides what we call peer recovery support, where he will engage the father or the mother, right? And so we sort of evolved as a father engagement unit to also extend the services to mothers who are struggling with substance misuse as well. And so Michael is in a role of a peer, right? And he
Great,
tells his own story of
great,
recovery. And
great.
so he brings that additional support early in the life of the case, because as you know, substance use and the recovery process is a lifelong and a very extended process. And because our child welfare agency's timeline in being involved with families uh, are pretty limited, and so we want to put or offer as many or support on the front line early in the life of the case as possible, so that we can help parents in their change process
Yeah.
to
So,
recognize their substance use and then do something about it.
yeah, Champana. So just to, again to jump in, so those fathers that are out here, we're going to have in the coming weeks. Please stay tuned because Champana's just mentioned some awesome staff that work alongside him. We're going to invite them on and to talk about these very specific topics. Champana, we're getting ready to land the plane here, so. As we said before, we're all in this work, ultimately knowing that we've got to create situations where parents work constructively together to raise their children in a safe, stable, and healthy way. So let's talk about that benefit. Tell me the benefits that you understand both scientifically and what maybe you've seen in your practice on how children benefit from the work that you're doing
I
over at
mean,
the events.
there's a large body of research,
That's right.
out there now, and that started in the mid 90s, and prior to that,
Yep.
there was not much, and the evidence is clear that when both parents are involved in the lives of their children, child welfare outcomes are enhanced. And so, what the body of research has looked at is that when fathers are absent in the lives of their children, or there is a lack of involvement, that there are significant implications for some children in terms of physical health, in terms of emotional health, in terms of mental health as well. And so, and the research is pretty specific to show that even with infants, right, when a child is experiencing caretaking from both parents, that enhances cognitive development even in infants, right? And so other child welfare outcomes when fathers are involved and actively participating in the life of their children throughout childhood, from infant to teenage years and adulthood, we're seeing things like greater academic performance from children. The it's less likely that children will drop out of school. Um, Less likely to engage in substance misuse or use drugs. Less likely to engage in early sexual activity or become teen parents. And so what I've found in my research is that the key is in the difference in parenting styles, right? That
Hmm.
when mothers parent their children, there are certain benefits that children learn from the mother's parenting style. And when the father is also actively involved, because the parenting styles are different, right? That it enhances a child's ability to be more of a risk taker, to
Yes,
develop more positive self-esteem and self-worth.
that's right.
Because fathers parent differently, they tend to be a little bit more physically. or physical in their parenting. They are the monkey bars. They take their children out to the park. They're engaging in all types of physical activity, and um,
And
I'm
even
amazed.
speech development, right?
Absolutely. Even speech development, just the pattern of the difference in the speech patterns of fathers and mothers, right? Because mothers tend to, um, parent more so by sitting down, talking, and sharing, information. Fathers, like I mentioned, are more physical, right? They
Yeah.
more demonstrate behavior. They teach through their behavior. And so, all of those in my own evolution as a father, I have to thank my own sort of professional journey for that, because initially I always knew intellectually that I was going to be important to my children when I became a father, but through this research I now realized how just important that I was, even just my physical touch, right? My wife demanded that I be the one to change the first diaper. But because the way in which I changed the diaper was very different in the way that my wife changes diapers, that is a benefit to the child, because
Yeah.
then the child grows up to have, to be accepting of different perspectives,
Yes.
right? And different styles of communication. Um, and the key is in the difference. The
Absolutely.
parenting styles and approaches are very different, and that's the key.
Yeah. Champana, you said something that I want to bring right back to dads that are listening in. You said you learned very early on that you were both a role model to your son and you
Absolutely.
are a relationship model to your daughter. So
Absolutely.
I want to leave that and park that with fathers who are listening in. I'm going to give you 20 seconds, and this is your opportunity, sir, to tell dads why they should pick up phone, send the email to come at least give it a try.
Right. What I'll simply say is that we need you, right? Because in our dad's parenting groups, the magic is in the group learning that happens, and so we need you to participate, not only because we know you're gonna get something out of it, because I do every time I participate in the group, but we need you there so that others can benefit from your own experiences, the things that you've done well, the things that you are struggling with, and
Yeah.
having those discussions. Without fathers, the group doesn't happen, and without this opportunity to sit down in an environment where there is no judgment, we don't typically have those opportunities in our day-to-day lives to have those discussions. I have a brother. I don't remember the last time I talked to him about parenting, right? um, but this dad's parenting group offers the opportunity that, this is what I'm going to get when I show up, and that when I share my story, it's not going to be unlike anyone else's stories. And what a lot of fathers walk away from is that, wow, my current situation is not my conclusion, right? And so I can come out of this being the ideal father, or on the road to being the ideal father that I want to be.
Great. Thank you, Champana. I'd like to ask our producer to put up the QR code and the link again. Fathers, please, um, uh, you know, act on this QR code. This is an awesome program. Give it a try. Sometimes we may be reluctant to step out. I want to encourage you. I know Champana does the same to step out on your child's behalf. Understand that fatherhood and the fatherhood journey doesn't need to be walked alone. And to quite frankly with you, is it really doesn't work when you try to work it alone. We are a community that, as Champana says, we need you. So please consider stepping in, leaning in, giving us a try. Champana, thank you. Thank you to you and your team for the work that you continue to do for fathers across our great county, but understand it goes beyond even our county. That it goes beyond Fairfax, it goes beyond Virginia. So thank you for the work that you all are doing. To everybody out there, tune in next week, and we'll have another exciting program. Thank you, sir.
Thank you so much. My pleasure.